Welcome to Your Health Your Way. We are Nottinghamshire's free integrated wellbeing service. My name's Penny and I am the SEND support coordinator and also the community engagement officer for the Mansfield and Ashfield area. So within Health Your Way, as a free integrated wellbeing service, we have a model of support that operates in 4 areas within health and wellbeing. So we look at smoking cessation, alcohol reduction, physical activity, and adult weight management, as well as family weight management, which I'll come on to in a bit. As a model itself, we work on a key model element. So what that means is when somebody's referred into our service, they are allocated a key worker. That first initial appointment they have with their key worker is what we call a My Story appointment, and it's exactly that. It's their opportunity to tell us their story. With regard to their story, we'll ask questions as well, and we want to know as much about them as possible. It's their story and they tell it to us once. As a key worker, we will then liaise with relevant staff and support workers in order to make sure the right support is delivered to the individual. We can offer multiple areas of support at any given time, but we are best to take lead from the individual themselves. So, for example, if somebody wants to quit smoking but also wants to lose weight, then we would look with them initially at a smoking cessation because we know that those that quit smoking may also pick up other habits such as eating extra biscuits with their cups of tea or having a chocolate bar on their cigarette break. We would recommend that if they want to lose weight and meet our criteria for physical activity, initially joining our physical activity offer, and then once the smoking cessation is underway or that we've had a quit, then moving the individual on to our weight management program. Each of our service offering has a criteria, which I'll go into in more detail in a moment. But once somebody's referred into our service and they're up and running, they'll have review points with us and with their key worker. So first review is at 4 weeks, then at the end of the 12 weeks, and then at 26 and 52 weeks. But the service as a whole, the intensive period of support is for 12 weeks, with support continuing for a whole year. The service then is available to all residents within Nottinghamshire that are 12 years and above. And the intervention is based on a 12-week intervention period. But again, this lasts for up to 52 weeks. We're able to provide a full range of nicotine replacement therapy products with behaviour support and motivational interviewing techniques. When we're face-to-face, we have carbon monoxide readers that are completed at every contact. So not just us, but also the individual can see their carbon monoxide reading coming down. We have follow-up appointments, as I said, at 12, 26 and 52 weeks, and we base ourselves in the community and where people are. So at the moment, we're operating outside of, within GP practices and also within community settings, leisure centres and hospitals too. All of our staff are relapse prevention trained, so any sign of relapse, particularly with smoking, we are able to draw people back into the service and offer continued support. I've mentioned already the adult weight management and the family weight management, but we also have a maternity weight management programme too. Our criteria for support is for individuals to have a BMI between 30 and 49.9. Anything above 49.9, unfortunately, isn't appropriate for our service, and we will work with the individual and the referrer to refer people on to other areas within the community that will offer this appropriate support. Our weight management offering then, we have 3 elements to it. We have a maternity weight management, an adult weight management, and a family weight management. Our maternity and adult weight management have a criteria of a BMI between 30 and 49.9. Anything above 49.9, unfortunately, isn't appropriate for our service, and we'll be working with the individual and the referrer to find an appropriate service within the community for them to attend. With maternity weight management, we're not looking for the expectant mother to lose weight, but to maintain a healthy weight throughout pregnancy. Our programme runs for 52 weeks, but we have an intensive period of 12 weeks where there's a session each week for somebody to attend. These sessions are run in the community and offer group support. We also offer telephone calls and telephone support and also a virtual offering as well. Weight management sessions are split in 2 halves, so 90 minutes in length, the first half being 45 minutes based on nutrition, and the second half is on physical activity. Physical activity element is purely based on an individual's ability. So at the My Story appointment, questions around physical activity are asked. And this is where we get to know you and your own ability and any ailments that we must be aware of. Weight management offer then. It's very similar to the adult weight management, however, it's family based. This means that a whole family is eligible for support if there's one child within that family who has a BMI in the 91st centile. BMIs can be worked out on our website on our BMI calculator. The idea behind it being a family weight session is that it's a family as a whole and it's a holistic approach. We understand that it's not necessarily the children that are taking the choices of what to have for dinner or what goes in the shopping trolley, but we also understand that some parents need the education and support on what is a healthy meal for a family. Although we don't have a mental health element to our service, we are very much aware that the mental well-being runs throughout our service, and we know that moving more, eating better, stopping smoking, and drinking less alcohol will support in a better mental well-being. Activity offer then is available for those residents who are 18 and above and who are classed as inactive or moderately inactive, or for those that complete less than 60 minutes of moderate physical activity per week. We provide a range of community and gym-based sessions, outdoor sessions, and we virtually run them via Zoom. Physical activity offers include circuit training, boxercise, fast classes, HIIT workouts, and also seated exercise. And we want to support people to break down those barriers to exercise that sometimes they find themselves within. We also support local initiatives such as the Couch to 5K and Walk a Mile a Day within the schools. Pension service is actually the only element of our service where there is a cost to the individual. This cost is around £2 to £3 per session, and it also contributes towards teas and coffees at the end of the session. The reason for this cost as well is the staff that run these sessions have to be additionally trained. They have to have Otago training. The sessions are available for those aged 55 and above who have mobility or stability challenges, or anybody who is at risk of fall or has previously fallen. They're designed to improve strength and balance. We do have a virtual offer for this as well, but we have found the benefits of being face-to-face and offering the teas and coffees afterwards offers that social element as well. So our alcohol reduction service then is available for those aged 18 and above who score an Audit C score of 15 or below. An Audit C is a questionnaire that's completed at the My Story appointment. It asks questions around an individual's drinking habits. If somebody scores above 15, we automatically refer on to the organisation CGL. They will work with the individual to stop drinking altogether. Our service is about helping an individual to reduce their alcohol intake and to support them to have the education around the impacts of alcohol on their health and their general well-being. Our service is supportive, non-judgmental, and aims to raise awareness around health consequences associated with alcohol consumption. Volunteering opportunities within Your Health, Your Way. So with our volunteering opportunities, we have both virtual and face-to-face volunteer opportunities available. We offer a minimum of 2 hours a week for flexible opportunities across our service. Training-wise, we're able to provide free training to all professionals. We have training regarding raising the issue of weight, alcohol IBA, so that's alcohol identification and brief advice, and also MEC training, making every contact count. That's around having healthy conversations. Then, how to refer. We accept referrals via our website. Individuals can self-refer, or they can be referred by a professional. We work closely with GP practices across the county, and the NHS can refer via their F12 function on System 1 or through Ardens. We also accept referrals directly to our NHS email box and also through phone calls through to our admin team as well. We give feedback to referrers if individuals have given that permission, but we automatically provide feedback to GPs or consultants. Thank you.